ACT government reached $88 million compensation settlement for Calvary Public Hospital takeover. The ACT government has reached a compensation settlement totaling more than $88 million with Calvary Healthcare over the controversial takeover of its former hospital in Canberra's North. Early compensation payments totaling $23.2 million were paid to Calvary in 2023, and talks have been ongoing about further compensation. The government has now confirmed a settlement was reached late last week with an additional $65 million to be paid. ACT Health Minister Rachel Stephen-Smith said the cash payment was in line with the projections and provisions made by the government at the time of the acquisition. "I am pleased that we have been able to reach an agreement that provides certainty for the territory and Calvary and effectively concludes the acquisition process," she said. Ms. Stephen-Smith said the government has waived some debts, liabilities, and other financial offsets to come to a settlement, and that it has also entered into an operations agreement with Calvary to support ongoing collaboration in relation to the operation of the Bruce campus. "I recognize that the acquisition and transition was stressful for many staff, and I thank the incredible teams at North Canberra Hospital and Clare Holland House that have continued to provide exceptional care as part of Canberra Health Services." Ms. Stephen-Smith said since the transition, there have been many achievements as staff have worked together across our hospitals to build a single integrated public health system. Calvary Healthcare's National CEO Damien Bruce confirmed the settlement agreement marked the end of the acquisition process. "We look forward to focusing on our ongoing positive working relationship with the territory to ensuring people receive the quality care they need when they need it," he said in a statement. But Canberra Liberals leader Leanne Castley said Canberrans should feel aggrieved over the cost of the takeover. "It disrespected Calvary, it disrespected the staff, and we finally have a price on what that really poor decision of ACT labor cost." Ms. Castley said it hasn't improved services. "We know the ACT is still one of the worst jurisdictions for emergency and elective surgery. $90 million is a lot of hip replacements and a lot of colonoscopies." Ms. Castley said the takeover was an appalling decision that showed arrogance from the government. Political decisions to take over hospitals under the guise that this will make things better are not good enough, she said. New $1 billion hospital to be built. The government made the Calvary acquisition to facilitate the delivery of a new Northside hospital on the site. The new hospital will cost more than $1 billion, making it the largest health infrastructure project ever undertaken in the ACT. The takeover was made possible through legislation that passed the Legislative Assembly, allowing for the government to compulsorily acquire the hospital's assets and effectively transition Calvary staff to Canberra Health Services. Calvary will continue to be an important partner in delivering health care in Bruce and across the ACT through its private hospitals and aged care facilities. Ms. Stephen-Smith said the ACT government will continue to work closely with Calvary on operational matters between our services in Bruce, including on the provision of utilities, the use and maintenance of the air bridge, and access to car parking. Earlier this year, Multiplex, which recently completed the expansion of Canberra Hospital, was appointed by the government as the early delivery contractor to plan and design the new hospital.